Oh, you look so young. Well, not all of you, but. So one of the things that when I was thinking about kind of my career path, okay, I only have one slide and I didn't get that right. We'll try again. So I do have a strange career path. You could say I have ADD, but really what I have done over the years is followed what I was interested and passionate about. So I grew up in a family that had a music business. Everybody I knew was a musician, so there's a little brainwashing going on. And I started playing piano when I was 3 because everybody else played, and you know, you're a kid, you copy. So I did that. It was a great way to put myself through undergrad. I played for churches and weddings and horseshoes and you name it. You know, give me $1 and I'll do it. So that put me through school. But my grandfather was a veterinarian, and I never knew him, but my father had worked with him. And my grandfather actually was not a graduate from a veterinary college. He decided to become a veterinarian. He was a farmer, became a veterinarian around World War I, at a time when there was a huge shortage of veterinarians and medical doctors. And so they decided, the government did, that they had a way around that. So they had books they had to take. It was kind of the original correspondence course. And they actually shipped cadavers back and forth on trains, and you picked up the cadaver and did the dissection and sent it back and it got graded. So anyway, so that's what my grandfather did to be a veterinarian, and actually his cousin actually did it to be a medical doctor and practiced well up into the 60s and 70s. So, you know, it's funny because I did grow up with that mixture of things, and my grandfather actually did the first colic surgery in Kentucky. I'm from Kentucky originally. So it went as many colic surgeries, not all, go when you don't have an owner that follows the directions. The owner was told to keep the horse in the stall, and the owner let the horse out of the stall, and that was the end of that. So right after the surgery. But, you know, I think, again, I have to tell you, you know, don't be afraid to follow your passion. So I will tell you, I had to convince someone I applied to vet school that I really wanted to be, they felt I was unfocused, that I really wanted to go to vet school because why are you doing this other stuff? Why are you involved in this? And so I think, you know, things have changed a little bit over the years, but so it's okay to be a little unfocused now. I think when you apply veterinary school, now we're looking for those well-rounded people. But so I was, I guess, before my time. So I did that. I went to vet school with the idea I was going to go back and go into general practice, and that was my plan. But I had a professor ask me if I was going to go and do anything else, and I was like, no, I just, you know, I have a plan. I know where I'm going, and that's where I'm going, and got a practice I'm going to. The guy I worked for in undergrad forever, and that's what's happening. And then I had some things happen personally in my family, and I decided maybe I don't have to go back. So I applied for internships, and I got an internship, so I did that. And I thought, well, I kind of like being in academia. I kind of get comfortable in going to school year after year, as you can tell. And so, you know, I made some other decisions along the way that kept me in school longer. So I did an internship, I did a dual residency, and then I thought, okay, at some point I have to go make money. So, you know, I went into practice for 10 years. And then I got a little bit bored during that 10 years, so that's when I decided to go to law school. And the reason I went to law school is because of reading in the papers about Genentech. That was the company that made all the money on growth hormone, but sort of kind of stole it from the University of California at San Francisco, kind of hired their researchers away. So I was fascinated by the idea of owning something that was biological, something that they really didn't create, it was already there. So that was how I kind of went to law school, and I thought, well, I'll go, and if I don't like it, I can always quit, because I have a job. So I did the law school thing, and I just kept doing it because it was fun. And then I decided intellectual property made sense. There's a lot of patent attorneys that do intellectual property, you know, more broadly, but also people that are many engineers that decide they don't want to just do engineering, biologics, people from all sorts of different disciplines. So patent law actually kind of makes sense. And I worked at a diagnostic lab for a year, and then I started working for Zoetis. Rhymes with lettuce, by the way, if you have trouble looking at it and knowing how to pronounce it. It's been one of those experiences that has really brought me to a whole different level of seeing the world And that to me was exciting. It was fun being my own boss. But the animal health industry is what I really wanted to bring to you broadly tonight, because I think most of you probably don't think, okay, you go to vet school and that's what you do to be in the animal health industry, but it's much broader than that. There are, for us as a company, we did our IPO in 2013, February of 2013, so we've just been a year out on our own. We've done pretty well. Our stock price is higher than it was when it IPO'd, so that makes us happy. And we bring as a company like 60 years of experience. So there's been mergers and acquisitions along the way, but we have people that have been there close to the beginning, still haven't retired yet, so obviously they're passionate about what they do. The other thing I wanted to really point out about the company specifically is we are global. We sell products, over 300 products in 120 countries. And we have over 1,000 researchers in R&D globally. We employ a total of about 9,500 employees worldwide, and that includes from discovery to sales to manufacturing. It's pretty broad. I'm going to actually go through a list here in a minute of the type of jobs we have currently. I went on our job site and looked, and in all the different countries that were involved. The other thing I wanted to do, though, when I really talked to you about how broad the animal health industry is, I wanted to ask you all a question. How many people have a pet? Okay, there's our market right there. Okay, actually, the pet owning public globally for us is quite a bit lower percentage than the livestock. And I think, you know, there's always controversy about livestock and the footprint and, you know, agriculturally what it means, but the animal health industry in general is a $22 billion business, and it's growing. Even through the leaner economic years, it still grew. And there's pretty much, it's surprising. There's the amount of animal protein, if you look broadly and you're counting meat, milk, eggs, everything, if you look at emerging markets, as you increase their animal protein, their whole quality of life goes up. And there's a lot of different studies about why that's true, but it's pretty much undisputed. Now, we're not saying they're out, you know, we need to have everybody eating cows, you know, but eggs and milk do make a big difference in these places. There are 220 million dogs and cats in homes globally. So you're part of 220 million if you have a pet. The other surprising thing is in emerging markets, and the main ones are Brazil and Russia, India, and China. In those markets, the amount of money spent on a pet goes up 15% every year. So they're not necessarily areas we think about people having that disposable income, but pets are very important to them as well. So I don't want to go over my 10-minute limit, but I wanted to tell you a little bit about kind of some of the jobs that are available, maybe some parts of the industry you wouldn't think about. So raising chickens. You know, a lot of people have backyard chickens now. That's not the poultry industry, though. I have backyard chickens. They're fun to watch, and you go get a couple eggs in, you know, a day, and you're happy, and that's it. And you could just go buy the eggs, and it would be a lot cheaper than feeding the chickens and all the chicken balls and all the fun stuff they have to play with. But poultry industry is a different world, okay? The poultry industry is fascinating to me, and I didn't know that much about it until I came to work for Zoetis. In the poultry industry, you have chickens that lay eggs, and then they ship the eggs to where they're hatched, and then they might be raised for a certain amount of time there, and then they ship them somewhere else to grow, and then they go to slaughter. So what happens with chickens that are going to slaughter, if you think about it, if you're shipping eggs around and things like that, you want to feed the least amount of food you can to get the quality out of the meat, or you want the eggs both to sell, but you also want eggs to be reproducing. So that's what you're sending to be grown up in these different areas. Well, you don't want to spend a lot of money shipping eggs. Think about how hard it is to go from the grocery to home and not crack eggs, right? So we have to have a way to check these eggs and a way to make sure that they're all viable. So there's huge, huge machines where hundreds of eggs can go through pretty quickly. And they're actually ultrasounded to see if their little hearts are beating. And that's how they know they're viable, and they can go into the incubators and go through the process. So we have engineers. We have a whole engineering department with lots of fun toys in North Carolina. Probably not something you'd think of as part of animal health industry. The other areas of work that we have, I had the list today, some of them won't be surprising. Microbiologists. Well, we make vaccines. We also make anti-infective drugs, antibiotics. So, okay, microbiologists, we need those people. Chemists, any kind of chemist. We have chemists that are analytical chemists. We have chemists that do things I don't understand what they do. So we have synthetic chemists. We have all sorts of things. We have immunologists. We also have parasitologists. And we have, engineers, obviously, but we have software engineers. We need people to come up with software to help manage like big livestock production places. We help develop solutions for those. Obviously, we have veterinarians at work, and tonight with me is a veterinarian who will be out to be available to answer questions as well, that works in our more of our outward facing. I'm kind of R&D kind of a person, and he works more in our customers, working with people out there. But we hired over the years, we have hundreds of veterinarians that work for us. We're one of the largest employers. We have logistics jobs, we have manufacturing jobs, so that's quality control, quality, pretty much anything that has to do with making a product, which is going to be pretty much any undergrad science degree you have. We have people that are obviously lawyers. We have people that are lawyers that don't know anything about animal health except contracts, right? They deal with contracts. We have a large number of patent attorneys. And then we have marketing people, we have business people. So there's a broad range. And we actually have quite a few business people that are veterinarians or have some other science background and decided they wanted to go into business. So there's always opportunities, and that's another thing. Don't be afraid of change. Don't be afraid of having, oh, I got a career and I need to stick to it, and what about that next job? I've always started looking for the next job from the first day that I started the job I'm in, just in case, The other thing I want to let you know is the animal health industry is truly global. And I'm just going to read through a list of the countries that we currently have job openings. In the United States, we have several sites in the United States. Canada, Poland, the Ukraine. Not sure anybody would want to go there right now. It's probably going to be a hard hire there. India, the Czech Republic, Costa Rica, Brazil, Germany, Belgium, France, Venezuela, China, Taiwan, Singapore, Australia, Mexico, England, South Africa, Italy, and Switzerland. So, multilingual is good. Taking a language wouldn't be a bad idea. English is the primary language in our company, but it certainly is a lot easier to negotiate deals if you speak Mandarin than if you don't, right? If you're trying to do a deal in China. So, just want to give you kind of that overview. Zoetis is a great company to work with, and Brian and I will be happy to chat with you about opportunities there from a broad view as a veterinarian, but also from other angles you might be interested in. So thank you so much for your attention.